In terms of categorizing different psychoactive drugs, in the field of psychology, we tend to think of drugs either as stimulants, opioids, hallucinogens, or depressants. We'll walk through some of the major themes of these four different categories. Stimulants have the effect of increasing or stimulating neural activity. Commonly, stimulants act as an agonist of dopamine, meaning they mimic dopamine. Various stimulants will have other effects. For instance, caffeine is an antagonist of adenosine. This has the effect of blocking adenosine, which is usually associated with sleepiness. This explains why caffeine can kind of make us feel like we are less drowsy. Nicotine has the effect of mimicking acetylcholine, so it's an agonist. It mimics acetylcholine, causing many of the same effects of acetylcholine, including a sense of skeletal muscle relaxation and focused attention. Opioids, in general, act as agonists of endorphins. This means opioids tend to have two common effects. They both reduce pain and add euphoria. When we talk about operant conditioning in the future, we'll begin to understand why opioids are so addictive. Because they reduce pain, the use of opioids is negatively reinforced, meaning we are encouraged to keep doing a behavior because it takes away something unpleasant, in this case, pain. Opioids, however, are also positively reinforced because they add something pleasant, a state of euphoria. So in other words, our use of opioids are both negatively and positively reinforced. So in a sense, we are encouraged to do them for two different reasons. Additionally, when people stop trying to use opioids, they tend to experience incredibly painful withdrawal symptoms, which can feel like positive punishment. Whenever a behavior is punished, this leads us to stop wanting to do the behavior. In other words, with withdrawal symptoms, they make us feel like we're being punished for not using those opioids. And then turning back to opioids, remove those withdrawal symptoms. Again, showing how opioid use can be negatively reinforced. Hallucinogens generally have the effect of altering sensation and perception. However, how various hallucinogens do this varies widely. For instance, marijuana has the effect of mimicking anandamide. In other words, it's an agonist. This means it will impact short-term memory and create a sense of relaxation. LSD mimics serotonin. Again, it's an agonist, much like marijuana. Ketamine, however, is an antagonist. It will block the neurotransmitter glutamate, which is an excitatory neurotransmitter. Finally, depressants have the common feature of slowing down the central nervous system. They do so by acting as an agonist of GABA. GABA is an inhibitory neurotransmitter. Now, when I am slowing down the central nervous system, whether it be from actual GABA or depressants, which are acting like GABA, this has the effect of slowing reaction time, disrupting visual acuity, impairing inhibition or reducing inhibition, and can potentially cause loss of consciousness. Additionally, when I use depressants, that can contribute to what's called a glutamate rebound. Glutamate is an excitatory neurotransmitter. After I have introduced what the brain believes to be a lot of GABA, albeit through depressants rather than actual GABA, it now has the desire to want to counteract that increased GABA level. That means it's going to release and produce more glutamate. So in other words, after we go to bed, the brain is trying to, in a sense, wake itself up through those excitatory neurotransmitters. This can explain why the morning after we perhaps feel less than rested.